community dentistry, dental public health. A World Health Organization WHO definition of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. According to the WHO, public health refers to all organized measures to prevent disease, promote health, and prolong life among the population as a whole. Its focus on entire populations, not on individual patients or diseases. Role of public health. Prevent epidemics and the spread of disease. Protects against environmental hazards. Prevention. Juries. Promotes and encourages healthy behaviors. Response to disasters and assists communities in recovery. Dental public health. It is the science and art of preventing and controlling dental disease and promoting dental health through organized community efforts. It is that form of dental practice which serves the community as a one unit rather than an individual. The term dental public health is comparable and synonymous with community dentistry, community dental health, public health dentistry, social dentistry. Dental public health concerned with 1. Dental health education of the public. 2. Research and application of the research finding. 3. Administration of programs of dental care. 4. Prevention and control of dental diseases. A public health impact of dental diseases. The most common diseases of the mouth are 1. Dental caries. 2. Periodontal diseases. 3. Oral cancer. 4. Developmental anomalies, acquired disorders, ethereal structure. Unique characteristics of these diseases are 1. They have universal prevalence. 2. They do not undergo remission or termination if left untreated. 3. They usually require more time and costs for treatment. Tools of dental public health. 1. Epidemiology. It is a study of distribution and determinants of health related events in population. The word epidemiology is derived from AP =on or upon, demos equals people, and logos equals science. It is branch of medical science dealing with epidemics. 2. Biostatistics. Statistics is the science of compiling, classifying, and tabulating numerical data and expressing the results in a mathematical or graphical form. Biostatistics is that branch of statistics concerned with mathematical facts and data relating to the biological events. 3. Social sciences. Sociology is the study of human groups. It is not concerned with behavior unique to individuals but pattern of human Relationship. 4 principles of administration. Administration is defined as the art and science of guidance, leadership, and control of the efforts of a group of individuals towards some common goal. 2. 5. Preventive dentistry. It includes I improve. Oral health status. There are 3 levels of prevention. These are 1. Primary prevention. This preventive measure is directed toward the pre-pathogenesis stage of the disease to prevent the occurrence of the disease. Dental health education, oral hygiene measures, immunization, water fluoridation, and fissure sealant. 2. Secondary prevention. It includes treatment of the disease to prevent the progression and recurrence of it, filling and pulp treatment. 3. Tertiary prevention. This preventive measure is directed toward the pathogenesis stage of the disease to restore the lost function, aesthetics, which has happened as a result of the disease, prosthesis. Procedural steps in dental public health. 1. Survey is the first step in the dental public health procedure. Surveys are methods for collection of data in order to determine the amount of disease problems in a community. 2. Analysis. Information collected through a survey is acted to an analysis in order to define specific health problems in the community. In the present modern world, electronic data processing media such as computers are resorted to for analyzing data. 3. Program planning. After the problem and its characteristics are analyzed, the next step is program planning. During planning of the program, it should be taken in consideration community's desire for intervention, cost, and availability of proven interventions. The program must be accepted by the community or to find an alternative method, which is comprehensive. 3. 4. Ethics and planning approval. All ethical clearance and approval from all the concerned persons and authorities is taken before implementing a public health program. 5. Program operation. After taking planning approval, a public health team has to be employed for executing the program. This can be best illustrated with the example of water fluoridation in a community. 6. Financing. Financing in public health programs are usually through the funds provided by the government or by the local authorities. 7. Program appraisal. This is the final step in any public health program, where the effectiveness of the program is assessed. Data collected in initial surveys serves as a baseline against which effectiveness of an oral health program can be evaluated or assessed. Similarities between personal and community health care. It is the names of the activities carried out by both the personal and community health worker that varies, while the aim of the procedure is basically the same. 1. Examination survey. Purpose of survey is to determine the nature and extent of the problem. Just as an examination is done when a patient comes to a dental clinic with a complaint. 2. Diagnosis, analysis. It is the procedure of converting data of survey by meaningful figures or statistics. Just as a dental clinician uses his examination data in addition to history and diagnostic tests to guide him to an accurate diagnosis. 3. Treatment planning, program planning. Once diagnosis is made, one can proceed to plans for effective treatment. Public health professional would like to have the ideal program plan. 4. Informed consent, ethics and planning approval. Informed consent of the patient is can before starting any treatment. Patient is explained all aspect of treatment planned. Similarly, all ethical clearance and approval from all the concerned persons and authorities is can before implementing a public health program. 5. Treatment program operation. Execution of the treatment or program once the plan has been made. After can consent, the treatment schedule is arranged and the dentist performs it. Complex treatment may require IV services of various specialists, which is coordinated by the primary dentist. Similarly, once a community public health program has been adopted, group of varied disciplines which constitutes a public health team may be utilized for execution of the program. V6. Payment program funding. The patient payment of the dental service can be in the form of cash payment or monthly billing, and in community health care the government usually is responsible for funding. 7. Evaluation program appraisal is assessing the effectiveness of the treatment or the health program.